All right. Hello, everyone. Welcome back to Public Health AmeriCorps Speaker Series. Can you believe that it is 2024? And this is our very first speaker series. This one is going to knock your socks off because we're going to be talking about career insights and guidance from governmental public health professionals. And this is in collaboration with our COAG partner, which is our collaborative partner called the Association of State and Territorial Health Officials. We affectionately call them ASTO. So this is going to be a great time for you to ask questions of folks that have been in public health, have been there, done it, seen it, and want to do more. So without further ado, next slide, Steve, I appreciate you. We're going to start this off with I don't want to say resolution, but what are we focused on doing for our career this year? So we're going to put up this poll, and the question here is, as we gear up for the upcoming year, because this is going to be a fantastic year, I want you to select the top 3 things that you are committed to doing to advance your knowledge, skills, and abilities in the field of public health. So think of it on the lines of your own growth and development. Let's take a few minutes and let's just see where we are. What are you committed to doing? Take about 15 seconds. I see it's going back and forth, back and forth. We got some ties here. Another couple of seconds. All right, we got to stop somewhere. So Steve, would you please end the poll and post the results, please? All right, so it looks like investigating and defining a career path and set career goals is number 1, followed closely by embracing your strengths and overcoming challenges. You know what? If you don't make a mistake, you're not learning, right? So those challenges are those lessons learned and what we could do better. And then it is followed by, with 39%, connect with a mentor and network with public health professionals. And I tell you what, thank you for taking the interest in doing this career poll, because everything that you just said in this poll is what's going to be addressed today in this speaker series. Remember, this is starting us off thinking about the growth and development of our career. Don't let anybody define your career for you. You do it. So that's what this career poll is designed to do, and then kind of get you in the mindset of, what am I committed to doing? How am I going to get my career from where I'm at now to where I want to go in 5, 10, 15 years? Thanks, Steve. Stop sharing. And next slide, please. All right. So usually I am the person that's facilitating the speaker series, but you know what? I have a colleague with some really fancy red glasses on that has agreed to help me facilitate the fireside chat and the speaker series this go round. So without further ado, I want to introduce you to Ashley Nandavongsa. She is ASTO's Senior Analyst and Workforce Development Representative. Ashley is a dedicated professional. She has a master's in public health from George Mason University, which is a very prestigious university in Washington, D.C. She currently plays a pivotal role in overseeing the workforce portfolio of learning communities. And the thing with workforce development, there's so many legs to it. So imagine her day-to-day work, especially when it's there to help people, like we said, get better in their craft. Before Ashley joined ASTO, she contributed significantly, tongue-tied already in 2024, to the nonprofit sector, which focused on communicable disease management, HIV and STI prevention, and comprehensive harm reduction strategies. Her very diverse portfolio includes supervising MPH practicum interns, allowing her to nurture, yes, nurture you, the next generation in public health. With a passion for creating meaningful impact within public health, Ashley continues to exceed expectations. She continuously reaches out to others to help them get better in their craft, and she also helps to advance initiatives. So without further ado, let's give Ashley a round of applause. And Ashley, thank you so much for agreeing to be the facilitator for today's event. So without further ado, let me turn it over to Ashley.
Thank you, Aretha. You definitely fluffed me up. I'm feeling really good. Thank you so much for that. Greetings, everyone. My name is Ashley Nyanthabongso-Mosley, Senior Analyst, Workforce at the Association of State and Territorial Health Officials. Super excited to be here with you today. Steve, if you can move on to the next slide for us. I'm going to provide a brief background on my organization, ASTHO. Then I'm going to kick off our fireside chat by introducing our esteemed panelists today. And then we will end the conversation with some of your questions and a survey from Aretha. Next slide, Steve. So just a quick background on our agency. ASTHO is a membership organization for chief health officials from the 59 states, territories, freely associated states, and Washington, D.C. Our mission is to support, equip, and advocate for state and territorial health officials in their work of advancing the public health and well-being. We have nearly 300 employees overseeing programs and services on behalf of our members. And the Public Health AmeriCorps program is under our workforce hat. So we're super excited to have these esteemed panelists who've dedicated their lives to the advancement of public health initiatives within the government sectors, and they play a crucial role in safeguarding the health and well-being of our nation's communities. Next slide, Steve. If you're unfamiliar with what governmental public health even is, it may be helpful to know that we have 59 states, territories, freely associated states, and Washington, D.C. jurisdictions, and also over 3,000 local health jurisdictions, plus tribal health jurisdictions as well. There are hundreds and thousands of governmental public health employees and more positions on the horizon. Next slide. So I encourage you to check out publichealthcareers.org. This is a site that's dedicated to promoting careers and jobs in governmental public health. And please check out this site by using the QR code for more information. And we'll share these slides with you after the webinar. Next slide, Steve. With that being said, I'm super excited to kick off our fireside chat and introduce you to our panelists. Next slide. First, we have Sandy Knoll, who is a first-generation Haitian American who began her public health journey at Florida State University as a student community ambassador in the Students in Service AmeriCorps program, which links students with local nonprofit agencies. Following her service in the Peace Corps as a rural community health advisor in Benin, West Africa, she worked as a case manager for a local health department, advocating for people with HIV and leading community outreach. Sandy transitioned to the State Health Office, where she now supports the program and planning functions of Florida Department of Health Children's Medical Services by developing technical processes designed to provide a continuum of health services for children at risk or who have special healthcare needs. She's currently a third-year Doctor of Public Health student at the Florida A&M University, and Sandy also serves as a board member for Sisters in Public Health. Welcome, Sandy. Next, we have Heidi Westerman, who is the Director of Public Health Data Modernization and Informatics at ASTHO, the Association of State and Territorial Health Officials. She oversees the ASTHO's data modernization portfolio of learning communities, capacity building, and technical assistance projects in support of data sharing, systems improvement, and effective data-driven decision-making. Prior to joining ASTHO in 2019, Heidi worked with the Vermont Department of Health and the New York City Department of Health and Mental Hygiene in tobacco, HIV, epidemiology, workforce development, and performance improvement. Heidi's love of data systems stems from her training in chronic disease epidemiology at the Yale School of Public Health, and her commitment to service is lifelong, but exemplified in her time as an AmeriCorps member working with Habitat for Humanity in New York City. Welcome, Heidi. Last but not least, we have Arnoldo Machado, who is the Director for Public Health Workforce Development and Resilience at the Massachusetts Department of Public Health. He has steadily climbed the ranks to his current role. Arnoldo began as a temporary worker at the Mass Health Customer Service Center, and he has 16 years of experience in state government. He holds a Bachelor's of Science in Management and Political Science from the University of Massachusetts, Boston, and Arnoldo is responsible for overseeing the workforce components of the CDC Public Health Infrastructure Grant. And he is also a key figure in designing and implementing the department's workforce development, planning, and assessment strategies. Arnoldo is a strong advocate for the principles of racial equity and employee engagement in the workplace, and he actively seeks to dismantle structural racism and ensure equity and belonging for all employees in the department, regardless of where they sit within the organization. So super excited to have everyone on. Steve, you can go ahead and stop sharing. We'll go ahead and start our fireside chat. Throughout our session today, our panelists will share their unique career paths, the challenges they face, the lessons learned, and provide interview and career advice. During this fireside chat, please feel free to ask your questions at any time. We will make sure to get to them first. But for now, I have a few questions that I'll kick us off our panelists with. So, panelists, our first question that we have, please share a brief overview of your current position and what you do. What skills or strengths have you had to rely on in this field? And we can start with you, Sandy.
Thank you, Ashley. So May of last year, I was actually promoted to my current position, which is Strategic Planner and Special Projects Coordinator for the Florida Department of Health, Division of Children Medical Services. In short, I'm not gonna lie, I do a little bit of everything. But in all seriousness, there are two sides to this role. So for the strategic planning side, I basically coordinate the division's program areas so that we can develop and implement the strategic plan for the division, consult all quality improvement initiatives, and I manage our performance management council. So that is a way to assess and approve the progress of our objectives or make any updates as we see fit. Regarding the special project side, that varies. And that's like the rush that I get from my job because it allows me to do all sorts of different things. For right now, I have been serving as a communication lead for emergency response for the division in Florida. I coordinate our social committee to build staff morale. I serve as the division's assistant liaison for monitoring legislative developments. And I write briefs on all sorts of different topics that we can bring up forth regarding the governor's office. But again, it all varies. Thank you.
Heidi.
Thanks, Ashley. I love hearing Sandy's intro because we have some overlap. So it's nice to see you all. I am Heidi Westerman. As Ashley said, I work with her at ASTHO, which is, means I get to help support members in all of our states and islands across the US. What does support mean when you're talking about a governmental public health organization? It can mean everything from hosting learning opportunities, webinars, even one like this. It also means some one-on-one work with each state. Like I could talk to Florida and say, hey, let's put our heads together. What's working really well for you? Do I have any resources that I can use to share with you? I will also say, and I think this is important for folks considering careers in governmental service, I do grant management, right? We have to write grant proposals. We have to write work plans and figure out how to measure and demonstrate to the federal government and other funders why we're doing what we're doing and if we're having an impact. So I also appreciate the variety in the job. And I really like that I get to talk to people all over the country, learn from them, and help share their good work with others. It is a mix of meetings and collaboration, planning and tracking, as well as like looking forward and then trying to anticipate what's coming next. So that's a little bit about me.
Thank you, Heidi. Arnaldo.
Hello, everyone. Arnaldo Machado here. Very excited to be in this space with all of you. As the Workforce Development Director within the Massachusetts Department of Public Health, I am largely working within the Commissioner's Office of the organization, so helping bring alignment to all that's being worked on at the bureaus, at the offices, and the public health hospitals. And if I were to define my role very simplistically, it's connecting people and getting things going and a lot of initiatives implemented. I am formally responsible for the recruitment strategies that we have at the department, as well as retention strategies, because you cannot just recruit if you're losing everyone that you hire. And also looking at opportunities for professional development, training, and building capacity within the workforce. I think that the diversity of the job is very evident by my previous colleagues here that already shared a little bit. But just to give you an example, today I was at a meeting talking about how to develop a program for leaders to lead with a racial equity lens in practice, not just in theory. And then the next meeting, I was talking about coordinating a photo shoot and a video contract to highlight our staff in specific domains and areas. So people like you who are looking for jobs in public health and ingressing into public health can see what the jobs look like and hear from people who are doing the jobs what it is like to be in the workplace. So very happy to be here and just giving you a little bit of what's like.
Thank you all. Since we have time and we're ahead of schedule, I'm gonna switch up some questions and ask you all, can you trace your career path for us? And how did you get to where you are today? Sandy.
Okay, thank you so much, Ashley. You know the dreaded words, and when I mean I'm talking to everybody. So what are you gonna do after you graduate? Or what are your plans? Personally, I cringed whenever anyone asked me that. I forbid that question. But you will never see it on my face. But my go-to response is, thank you so much for asking, or I can't really say anything right now because I'm still working on my options. And I would smile, but I'm cringing inside because I just get frustrated. Like, why don't I know? Like, I'm stressed out, like, don't ask me. But nevertheless, those type of words motivated me to figure that out. And to alleviate that stress, it propelled me to, okay, before anyone asks, I need to figure out what I'm doing. And that led me to having informational interviews with people ahead of me. I'm all about anyone that's ahead of me, just so I can see what happened to you, what did you learn from your lessons of your path. What should I be doing? Are there any programs you suggest? And I weave those questions in as I'm trying to talk to people about what they did. And that's what led me to even my first experience while in undergrad. Someone emphasized, you shouldn't wait till after you get your degree to get job experience. I said, that's a great idea. What should I do? That's how I learned about the AmeriCorps program. And it was from someone just suggesting, it's all about people's suggestions, because if you're going to say something, what does that mean? What did it look like for yourself? But how can I use that for myself? So that's how I learned about the AmeriCorps program. It was from networking, someone telling me about what they did or that they wish that they'd done. And I said, okay, well, let me apply to see how it worked for myself. And I'll clue them in because everyone's part of my village. So if you have a suggestion, automatically you're my go-to person for that one suggestion. And then until the next step, I will get some insight. Because while I was in AmeriCorps service, that's when I met my first return Peace Corps volunteer. I didn't know about any of these programs. It was all through being open to people about, hey, I'm in this section in my life, and I would love to hear about you, because a lot of people love to talk about themselves. I mean, hence that's why we're here. We want to talk about ourselves, but not to just be boastful, but just inspire you to, okay, from what Sandy said, Arnaldo said, Heidi said, like, let me do this for myself. So that's how I learned about the AmeriCorps program, Peace Corps. And while I was in my Peace Corps experience, someone overseas said, she was an older woman with grace. And she said her biggest regret, because she started living in overseas for so long, that as she got high up in the ranks of her career, someone finally asked her, do you have a master's? And she said no. So she had to stop her career just to go back to the States and pursue her master's. So her lesson learned, she said, Sandy, don't wait until you get higher up. Just quickly get your degree and just go from there. So I said, you know what? I'm going to stop my service after 3 years. And then I pursued my master's. And in my mind, after I get my master's, the sky's the limit. I'm going to pursue whatever job that I come across. And it led from one thing to the other. But that was like the main thing when tracing my career. It was really an intentional networking, talking to people and keeping them in the loop, and really using their suggestions as like their past mistakes, but as clues for myself.
Sandy, thank you. There's a question for you here. The question is, since you served in Benin, West Africa as a Peace Corps volunteer, what is your advice for someone who is interested in participating in the virtual Peace Corps service?
Okay, thank you. That's a good one. So with Peace Corps and serving virtually, a lot of people might feel like, oh, well, this is not as real as going overseas. I've heard that. I've come across some people who said that. Don't think that, because service is service. And I still keep in contact with the country office that I served in Benin, and they'll take any sort of help or assistance any way they can. So all you have to be mindful of is, what skill set can I provide? Be open. Don't box yourself in by saying, okay, well, I am only looking for public health experience in this country. Don't limit yourself, because even for the Peace Corps, I didn't tell them anything besides just let me go. Send me where the need is great, because I don't want to feel like I wasted my time. Because I want to be of service from the beginning to the end. So apply, polish your, whatever country that you're looking out to apply for, polish your language skills, because I know more and more, it's one thing to have the requirement to get into the Peace Corps, but you have to maintain your language experience and skills throughout your whole service in order to write grants, because imagine writing grants from in English and in French. That's what I had to do. Thank you.
Thank you, Sandy. Heidi, same question. Can you trace your career path for us, and how did you get to where you are today?
Yeah. So I'm going to go backwards from now, right? So now I work at this national association and get to think about things across the country. And it is US focused, but fortunately, because we get to work with some of our islands in the Pacific, we get a little bit of that global flair that I'm jealous about from in the Peace Corps. And I came to ASTO because I was interested in learning more about that broader perspective. But I came from a state, so I have really specific applied experience for about 10 years working in state and local public health. And it was awesome. And I may go back and work in a state again. I want that door to remain open for me. But when I was working for the Vermont Department of Health, I was really doing applied epidemiology. I was talking about tobacco statistics. I was pulling together reports, and I was working with some people across a broad spectrum of programs using data to inform community action, to bring to the governor, to talk about what were the most important health priorities in Vermont. I grew up in Vermont. I live there now, and I'm very connected to the community. So that was a very rewarding place to be and to work. But I do really like that I have now on a national level and get to balance that small state perspective with a little bit more variety. Prior to working in Vermont, I was in a very different local health department, New York City. Some would say that New York and Vermont are quite different, though both still in the Northeast. New York is one of the biggest, and I would argue one of the best health departments in the US. There is so much going on in New York. So to have the opportunity to look at HIV surveillance in the New York City perspective, where over 100,000 people are living with HIV and getting 1 million lab records a year, there was a treasure trove of data for a young epidemiologist to work with. And that was a really eye-opening and excellent training ground for me when I was early out of my master's program. So working backwards, ASTO, Vermont, New York, master's. I think Sandy's advice is a good one. If a master's is something that's on the table for you, and I don't think it's needed in every place or space, but if it's something that's on the table, I do think getting that in and learning in that academic setting is a really nice complement to applied learning that you can get in other ways. I enjoyed getting my master's. I focused in chronic disease epidemiology. I really honed some skills in data analysis and management, which are more technical skills, right? I didn't choose to focus on policy or systems, even though now today I spend a lot of my time doing systems thinking work. That foundation in epi as a core element of public health is still part of how I describe myself. And I'm really glad I have the academic background to kind of stand on and build out. But I didn't go straight to grad school. I did take a break between undergrad and grad school, and I did AmeriCorps. I'm really glad I took that break. I think it helped me apply real world perspective to grad school. So it seemed to me that that 3-year chunk of time was a good fit for me. I did AmeriCorps, working in Habitat for Humanity, as Ashley said in my intro. That is public health too, right? Housing, the basic needs that all humans need to thrive is really important for understanding what's actually happening in our communities. And I actually loved doing construction. I got to lead groups of volunteers building walls in the Bronx. So if you all need a good, fun experience, I strongly recommend reaching out to your peer AmeriCorps folks who may be still working with Habitat. And I did get to fit in after AmeriCorps a little bit of classic healthcare and public health research. So my smattering career trace, I like to think of as all of them being complementary pieces of the puzzle. And I hope that there are more puzzle pieces in the future, right? This career is not done. I have more to give and more to learn. And I think that my hope is that I will keep finding and pursuing opportunities that are complementary, but are different, right? I'm excited about trying different and new things all the time. So a passionate generalist is how I would describe my career path.
Thank you, Heidi. And Arnaldo.
I would love to do the backwards tracing, but I don't think my mind is organized that way. So I'm going to go from the past forward. As a white Latino man, I came originally from Brazil, and my first jobs in the US were not office or professional type of jobs, right? I worked at coffee shops. I was the janitor at a clothing store. So there are all of these things that I bring with my experience and my identity as an immigrant. My first job in an office, in somewhat of a professional setting, was with the Mass Health customer service, as was described in my intro. And I came in as a temp. I did a 2005 and a 2005. I do a Word, an Excel test. They asked me a few questions. Yes, I passed. I landed a job as a temp. Did an extensive training that was so confusing to a lot of people about Mass Health eligibility. If you ever read your Medicaid eligibility rules, yes, that's what we were exposed to, and landed the job. With that, you start off as a member services representative, talking to Medicaid members with real issues that they have right then and there that they need support from you. They're often not calling you because everything is going well, right? So definitely some of that de-escalating and all the skills that you get from working in a customer service office, especially a high volume customer service office like that. Those are experiences that I'll carry with me today, even as I'm responding to an email, right? And from then I was promoted to work as a provider services, dealing now with the healthcare facilities that were calling about their bills and the policies and trying to understand the benefits for a member, and then becoming a supervisor and leading a unit that looked at the eligibility process for Medicaid in Massachusetts. All of that happened because that was the first job that I got in a temp agency. So I landed in public health by accident. I got my business degree, started that while I was there. Then I transitioned to a mass health eligibility office, now working directly for the state, processing applications once again, talking on the phone with a lot of members. Moved on to a manager position a year and a half later, working at a processing center for documents. And also there was an inbound call center, and stayed there for 8 years at the Central Processing Unit for Mass Health, until I finally thought I was stuck after 8 years trying to become a diplomat, trying to become an IT person. And then boom, the first job that takes me is the Department of Public Health with a role in administration. My first time as an assistant director in administration, working now in the sector of human resources, IT, and operations. One of the things that attracted me the most or that impacted me the most as I joined the Department of Public Health was the people, right? You work with amazing, passionate people. When you're working in a call center, it's hard to find someone. There are those that are really there to help people. But when you go to the Department of Public Health, everyone is there to help people, and they're mission driven, there is passion, and there is a lot of expertise, a lot of people that you learn from. So even in my role that was a little more administrative, I got to speak to specialists and learn more. I was introduced to the concept of racial and health equity that I had been oblivious to up until then because I didn't have the formal, academic study in public health. And then now I've been promoted to my current role. I like to highlight that early experience because when I had to apply to a manager job or a supervisor job, I had to draw from my store manager experience at Dunkin' Donuts, right? When I had to talk about my ability to work with people and deal with conflict and HR mediation, the customer service experience was very helpful. My specific team manager experience was also very helpful working with labor in the union environment. So it's not just having a title that reflects where you want to go, but the skills and making the most of the experience that you're exposed to along the way that really gets you there. So that's one of my advices, looking at the skills you're getting transferable or directly related to the role so that you can highlight and land that job that you want. And I love my current role.
Thank you so much, Arnaldo. Okay, me looking into the chat really quick. Sandy, there was a thank you for your answer to the first question. They said, thank you, Sandy. I needed to hear that positive response. I will be applying. Thank you. And guess what? I want to join the Sisters in Public Health. Another question for Sandy. How would you describe your experience in Benin and how has it helped your pursuit of your master's program?
In one word, I don't know how to do that, but I would say it was life-changing because everything that I did in my Peace Corps service and AmeriCorps service, it is overflowing right now in my career. The biggest thing is, I guess the biggest skill set that I learned from both experiences was I made myself, you know how when you first start a new job and there's that orientation and you need to be trained? And there are people who they need to be trained. I don't need to be trained. So at any job, I may not know the job. I'm not saying I'm perfect, but in a sense, I can figure it out myself. I will use my resources, just give me whatever I might need for the position. Heck, if I need to read the previous person who had this previous roles, like what they did, I will figure out what I need from the job because you'll never know what I don't know. I tell my supervisor that all the time. But that's what my Peace Corps and AmeriCorps service taught, because no one is there to tell you, hey, they might tell you what they might need from you right off the bat, but there is no long, hard training for the most part. There is like, hey, like, can you just pick up the pace? We just need you to catch up. They'll never tell you they need you to catch up, but you know, when you're looking at them, they just want you to catch up. And that makes no sense. But in hindsight, I take that as, okay, that's a challenge. I like challenges. So that's what my Peace Corps and AmeriCorps experiences really, really taught me. Just take the challenge and just run with it. Plus, if there wasn't a rule, just make it up. make up a whole process. That's what I did with my AmeriCorps experience. Because similar to Heidi, I didn't build houses. I was the assistant to the executive director, and she had just started her role. And she just needed help setting everything up for a homeless shelter. So they didn't have a website. I never made a website before, but I said, well, let me just learn how to create a website. And it was skills that I knew that, well, at some point I'm going to want to say, well, I know how to create a website. And that connected with my AmeriCorps service. And then for Peace Corps, I was able to train, because I've always wanted experience in how to train people and how to lead different presentations. I got to do that. No one questioned it. It's just the fact that I wanted to do it. That's what made them, okay, well, go for it. Create this training. So just the sky's the limit, but be mindful of, okay, take it as a challenge, but use the parameters of the position and then just run with it. I hope that helps.
Thank you so much, Sandy. And thank you, Aretha, for putting everyone's LinkedIn into the chat. Panelists, we're hearing that they want to connect with you. So Aretha is dropping some LinkedIns into the chat. Folks, please have your questions coming in. Since I don't see any more, I'll ask my next question to our panelist. So 32% of state and local employees said that they're considering leaving their workplace within the next 5 years due to retirements, job transitions, etc. What career advice would you give the Public Health AmeriCorps members interested in joining the governmental public health workforce at this time? And are there any specific interview or job search advice that you'd like to give them? Start with you, Sandy.
Yeah, so advice, it's more about your skill set, but also, are you dependable? Because it's so obvious, and we're experiencing it so much that they're coming in, they have left the workforce, but with this, anyone thinking that the transition is being so rampant, how do we know that you're dependable? So I would use that more so to emphasize, okay, because when looking even at different resumes, you want to know, okay, the trajectory of how long have you been in certain positions? When you transition from one job to the other, what was the mode of transition? Was it because of your job, or were you in between something? And be mindful of your in between. Because when I was in between my first job with the county health department and while I was working on my master's, that gap, do you know what I did as my gap? I mean, you don't know, I'm just, again, don't mind me. But for one of my projects in my master's program, we had to find a local nonprofit and help them with a grant. I made it a real project. So I found a real nonprofit in Jacksonville, Florida, and on my resume, I consulted. Even though I know that was a whole school assignment, I made myself a consultant, and that was a real consultant job. I'm not going to lie, because you're really helping the nonprofit with a grant. So don't excuse the gaps, but again, it ties in with how can I make myself look and be dependable when it comes to talking to like the governmental workforce, because it's all about while you might think they need you, they really can look at the next person, but you want to make yourself like more credible than the next person. Thank you.
Heidi.
I will +1 everything Sandy said. I'm learning so much. And I'll add that right now, governmental public health is not easy. I did get to have a little bit of time. ASTO lent me back to Vermont for a smidge during the vaccine rollout in 2021. It is the hardest I have ever worked in my life. And I was exhausted when I came back to my ASTO job. And everybody who's still in governmental public health, the ones that are left, are still tired. And I think being really cognizant of that time and challenge that was the pandemic, specifically for public health employees and really for all government employees, right? There wasn't a sector that it didn't touch. So I think being really patient and managing your expectations about the pace that things can happen, but don't let that dampen your new energy, right? You have new energy, you have new ideas. There are going to be some people in that space who are excited for some fresh perspective, for some fresh hands to maybe lighten the load. And I think finding a balance there will require a lot of communication. I learned some skills over the course of the pandemic about being more transparent about my needs or my concerns, or where I did have bandwidth or maybe I didn't. And I think those are the types of skills that we all need to bring into this next phase, in addition to the harder technical skills that are, certainly important in the work. I'm happy to talk more about that, but I will say being patient and bringing your energy together is my number one tip.
Thank you, Heidi. Arnaldo.
Hi. So one of the things that I think that AmeriCorps members are, and anyone that participate in these type of pipeline and pathway programs are particularly well positioned to do, is that you're working in practicums and you're having some experience as you're immersing yourself in your projects with your host sites and with the program, right, through AmeriCorps. And one of the things that I hear from departments as we're talking about people ingressing into the workforce, if you're coming straight from school, the academia does not prepare you 100% to ingress into real life work at public health. It gives you all the tools and theoretical frameworks and all of that. So it definitely does help a lot. But having this opportunity to get your feet wet and understand how the relationships work, have some experience is important, and highlight that, right? You have that experience that you're acquiring through the AmeriCorps, highlight that. It's a really game changer when you're applying for a job, especially if you're at the entry level, right? Job. So practical experience is important. The other thing is there are many jobs in public health. Public health needs people. At the same time, look for the job that speaks the most to you, if you can afford that. I know that sometimes we can't afford that for whatever reasons, but if there are multiple opportunities, apply for the ones that speak to you the most from a mission, from a passion standpoint, because like you was said, it is a lot of work. It is a lot of hard work. There are many requests that come and multiple times, both from external parties at the community as well as from within. So if you have the passion, that's going to fill your well, right? That's an expression that we have, the things that fill your well and that you're able to draw the water from when you need it. So really look at that passion component, the mission component, and some of the skills that are really important when you're working in public health is contract management, grant management alongside that, right? So some of the administrative skills that sometimes are overlooked are really important. So if you have a chance to get those skills through any of your experiences, go for it, because that's going to make a difference for you down the line. I had to struggle to learn how to manage contracts, and happy to be getting ahead of the curve here in that space. But yes, so definitely try to understand how the department relates or local health relates to the community. Understand, because that's something that's in need nowadays, form those relationships. If you have a particular identity that you want to highlight and there are groups within your community that engage within that identity that you have, may be worth making a connection, learning about them, and that's going to be invaluable if you ingress into the public health workforce.
Thank you so much, Arnaldo. Okay, we have a plethora of questions that I just received. Panelists, if you can keep this under 2 minutes, because I know we're running short on time. The next question I have is, I recently joined AmeriCorps. Currently, I have a degree in human resources and almost done with my master's. But thinking of entering public health, what steps do you guys suggest? And anyone would like to take this?
I'm sorry, Ashley, can you repeat that question? I heard the master's part, but continue.
Yeah. So this member recently joined AmeriCorps and they have a degree in human resources, almost done with their master's, but thinking of entering into public health. What steps do you all suggest?
Okay. Conferences help. I always, even when deciphering between, do I want to pursue a doctorate or not? Why should I pursue it? Because you really should know why you're doing something. I like to go to conferences, preferably if they can be covered by a school, that's ideal. But if it can't be, consider it as an investment to you, because it's no different from anything else you would be doing. And YouTube or other platforms, because there are plenty of webinars out there on public health. And don't feel like you need to know exactly what steps to take. Because like Heidi said, you don't have to feel like you need another master's in public health to be in public health. You might want to consider going to your local health department. Maybe, do they have any events going on that you could volunteer in? Because I like to scope things out. And you want to see if it's really for you. And information interviews are key. To be honest, like that's something we all should be doing, because you don't know where you're headed. I still don't know where I'm headed. And all it takes is having that conversation with someone, like just to gauge and see like, how did this work for you? So that's my suggestion. Good luck.
I'll just do a quick add-on to that. I will say, we need people with HR expertise in public health. I think Arnaldo and I have like done some on-the-job learning, but like it would be great to have that type of expertise. And so learning a little bit of the public health side and bringing that HR is a win-win. So don't shy away from that. But I love Sandy's suggestions about getting exposure to what types of things are going on in public health to know if it's the right fit.
And if I may complement that, since my role is niched right into the HR world, right, as workforce development, I do want to say that some of the partners that we have at the national level, like ASTO, they really provide a lot of resources for people that want to catch up on what HR looks like and what the needs are, not only now, but also a prospective look at what's coming up for workforce development and workforce HR within public health. These are partners that have a lot of information and content available, many helpful articles, like with burnout and all of these things happening with the public health workforce, especially after a pandemic like COVID. There is a huge concern for the workplace well-being, and safety and security and employee empowerment, right? So all of those things are available as national resources, some from ASTO, some from other sources. And I think it's very helpful to supplement what you have as your academic formation in human resources, and then building, additional competency as it relates to public health. For example, the view that we have been historically provided in HR of diversity, and moving that to an equity lens, and really understanding how you apply the principles of racial equity and health equity, not only to the communities, but to the internal community that is the workforce within the departments, is very important. So there are many things and articles and concepts that you can learn that will complement what you have. I only started my master's in public health this summer, so I also don't think it's very late for anyone that wants to pursue a degree and don't have that right now. I had a business and political science degree as a Bachelor of Science, and now moving into public health because I felt it was the right time for that. So there is also that. I hope that's helpful.
Thank you. Few more questions briefly. Would you all agree we need to not just be of service, but also creating networks and contacts at all levels is key for our career choices, jobs, education? Shout out from El Paso, Texas.
Absolutely. And I'll be brief because we less than 2 minutes. This position that I have now, it was all from a referral. Because previously I was Florida's cancer program director, like loved my position. But then my current supervisor just called and said she heard about my skill sets. And I'm thinking, what skill sets? But you never know who's watching. And it's all about being mindful of, okay, connecting with others, like you have, because I love connecting the dots for people, and regardless if it's an organization. And I'm always volunteering. That's one of the best advice I got when I was an intern. Someone said, just keep volunteer. Like I volunteer for different committees, and mind you, don't overwhelm yourself, but volunteer so that you can just get to know people, be in a space where you're constantly being connected. And that's how people, like, whenever they'll hear about certain opportunities, they will naturally, oh, well, I know someone named Sandy, like she would be great for this. And you just never know how it might circle back to you. Thank you.
Heidi or Arnaldo, would you like to add anything?
I can add, if that's all right. I think the relationships are very important, not only outside of your current jobs, but in your current jobs. As the Assistant Director of Administration within the Bureau of Substance Addiction Services at the Department of Public Health, I formed some relations. I volunteered to participate in organizational projects, and that created a connection and some visibility within the department, so that when I applied for a different role in HR, and I was suggested to apply to the current role that I am in, that was much higher than I thought I could do at the time, because people saw the experience that I had previously demonstrated, the contacts that I had formed. So it's also important to form those relationships, even in the current job that you're in or with the organizations that you're interacting with in the course of your current job.
Thank you, Arnaldo. On to our next question. To all panelists, if you could travel back in time to a challenging point in your career and give your younger self one piece of advice, what would you say?
I can take this one first. I would just say I have learned to be more patient, and I wish I had learned that earlier. There is a lot of value in getting more perspective and talking to more people and building those networks, to add on to what Arnaldo was saying. And I don't subscribe to the myth that government is full of bureaucracy. There is some process that has to be followed that is government specific, but there's process that has to be followed in every sector. And so I think, don't label it bureaucracy, but think about why sometimes it is important to be patient, to be more inclusive, even if it's harder and takes longer, and to advocate for that in the spaces that we work in public health. That would be my advice to earlier Heidi.
If I were to earlier Sandy, I would definitely not overthink. You know, when you're considering all your options, you tend to overthink, oh, well, if I do this, if I do that, just do. But again, like, don't look back at it. I would have done that sooner with some of my experiences.
If I were to give, so I'm sorry, could you repeat the question again? I think I missed that a little bit.
Yeah. If you can travel back in time to a challenging point in your career and give your younger self one piece of advice, what would you say?
I think believe in yourself. Sometimes you can get stuck. I mentioned that I stayed 8 years as a manager in a mass health eligibility office, and that was tough. Getting 80 rejections over the course of those 8 years, no interviews sometimes, and you're thinking, hey, I have some experience and it's building up. Why are people not contacting me? And also, if you're looking for jobs, look with a purpose. Don't apply for everything because that leads to burnout. Apply for the things you really want. So those are my 2 pieces of advice.
Our next question. What are your thoughts on LinkedIn? As a young professional, do you believe enhancing your online professional presence is helpful or a time sink?
Helpful. I've actually had some folks blind cold reach out to me through LinkedIn, and I've been able to get information about them before I respond, right? Because they've chosen how to represent themselves. I've chosen how to represent myself, and it sort of levels the playing field. I also think that there is a limit to that. Do not reach out to everybody on LinkedIn and pester people with questions. Like, be strategic, be thoughtful. This is a person who has a path, or who's in a position I'm curious about, or maybe is an opportunity for an informational interview. So I would discriminate in how you use LinkedIn, but I do think it's worth building a basic profile and keeping up to date on what's going on.
So ASTO has several programs. I can't quote all of them, but I participated in a program called DELF, Diverse Executive Leaders Leading in Public Health Lab, a couple of years ago. And one of the sessions we participated was about branding. As public health leaders, we should always be mindful of how we brand ourselves and that's what you have control over. I am going to put in the chat as I'm talking, because LinkedIn is one of the key platforms that we have to brand ourselves. And it's from what we believe in regarding like personally, but also like with the work that we're doing, it's all about like how you brand yourself. And LinkedIn is one of the biggest platforms. But you just be mindful of not everything has to be put out there and how you want to put it out there. If LinkedIn is like your main platform, then use that to your advantage, because you have no way of knowing how it can circle back to you professionally, how you can get more opportunities for like speaking engagements or even personally. So it all depends. That's what got me involved with Sisters in Public Health. I found out about it through LinkedIn, to be honest.
And I think even generationally, right, there are different uses for LinkedIn, where younger folks right now are going for jobs in consulting, not exclusively, but that's like a huge trend, right? If you're going for jobs in consulting, they're project-based, they're almost freelance type of work that you need to build your community and source jobs from. LinkedIn may be a very helpful very helpful tool. So depending on what your use for the network is, you may use it more or less, but just be aware of what you're using it for and then really tailor your content there for that.
I want to thank all of our panelists. We still have some questions in the chat. We're going to compile that, send that to our panelists, and then that's going to go out in your newsletter for this. I want to thank our panelists for being here today. Thank you, everyone. We got 80 folks on. This was great. Super glad that this was helpful to you all. I will kick it to Aretha to close us out. Thank you all again.
Awesome. This was so great. Didn't I say I had a treat for you to start us off in 2024? And let me tell you something. They delivered the chocolate, the Slurpees, the Frosties. They gave it all. And I am so thankful that you had so many great questions for our panelists. Our panelists were amazing. And I want to thank Sandy, Arnaldo, and Heidi. Thank you for your answers. Thank you for being here. And I also want to thank Ashley for being the facilitator of our fireside chat. It was a great time. I've learned something as well, not just something, but a lot of things about careers and, your past. And what I really liked about it was the diversity in thought, careers, your trajectory, all of that information. And these are the things that we want to give to our public health members. So thank you again for being here and taking time out to talk about our next generation. We're so excited for this information. So a couple of things before I let everyone go. We are happy to announce PHA's first ever career fair. We have 2 events this year coming up. Put these down on your calendar. The very first one is March the 7th from 11 to 6:30 Eastern Standard Time. If you can't make that one, make sure that you make it a point to put May the 9th on your calendar. Same time, 11 a.m. until 6:30 p.m. Eastern Standard Time. It's a virtual career fair. Look in your member newsletter. You'll be able to sign up. You can do real-time interviews. You can have your resume looked at. So please make it a point to put that on your calendar so you can start to explore what's available to you. You said you want a career development. You said you wanted to get a job in public health. We're giving it to you. March the 7th and May the 9th. The next thing, our next speaker series is February the 8th, same time, we're here. And make sure that you sign up for our member newsletter, because that's where you get all of this awesome information about public health, about internships, about fellowships, about career pathways. And again, we could not do this type of work without you. Thank you for being an intricate part of our communities and taking time out to make a difference. Thank you again. We will see you all next, was it February, next month? And all of the questions, there were so many questions, we're gonna compile those. And again, go back to the member newsletter. You have any more questions that you want us to get to the panelists, please put it in our Public Health AmeriCorps email and I'll get you some answers. Until next time, ta-ta for now. We will see you and thank you all for joining us for our very first speaker series in 2024. See you next month.